The most important way to get started is to find like-minded individuals. It's very hard in our system of government and policy and really in society as a single individual to make a profound difference. You need to build coalitions, you need to build alliances.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest today who has just done so many incredible things through his career and is now serving the community in such a tremendous way. One of our wonderful state representatives here, Representative Venkat. Representative Venkat, can you please just introduce yourself and kind of give a brief overview of what you do right now?
My name is Arvind Venkat. I'm the state representative for the 30th legislative district, which is in the Northville suburbs of Pittsburgh in Allegheny County. I was elected in 2022 and reelected in 2024. And I'm also an emergency physician. I am a practicing emergency physician and the first physician to serve in our state legislature in over 60 years.
I was not aware of that at all. That's an interesting fact there.
Yeah.
We need more physicians, I think. We need more clinicians in leadership, both in institutions, but also in government. So that's awesome. And thank you so much for coming on. It's a meaningful conversation to me. Can you just, for our audience, tell me a little bit, I'm here in Philadelphia, Pennsylvania. So it's definitely geographically, I think, a little bit of a ways from where you are. But can you tell me a bit about the population that you serve, both as a physician, but also as a representative?
As an emergency physician, I really serve everyone. I practiced in the Pittsburgh area for close to 20 years. Before I was elected, I was at Allegheny General Hospital, which is a level one trauma teaching center, very similar to the large urban hospitals that exist in the Philadelphia area. After I was elected, I moved my practice to a smaller community hospital that's actually in the district that I serve. My district in the Northville suburbs of Pittsburgh, it's a suburban bedroom community. It's the communities of the western part of Hampton Township and all of McCandless, Franklin Park, Ohio Township, Kilbuck, Emsworth, Ben Avon, and Ben Avon Heights. And it's a very well educated population, and it has a lot of individuals who have either healthcare backgrounds or scientific backgrounds or engineering or business backgrounds, but it also has a lot of people who are retired senior citizens, as well as those who are, doing work that doesn't require a college education or hasn't required a college education, but are very skilled. So we have a lot of skilled tradespeople. We have a lot of people who are workers in the meds and eds economy in our area. And so having a healthcare background like I do hopefully fits the community well as their state representative.
That is great. And that makes sense why you would be a physician, one of the first in 60 years, elected by, of course, that community. That makes a lot of sense. I have to ask, though, being a physician, I talk to a lot of physicians. I really try to keep my kind of finger on the pulse of what they're feeling. I'm sure some of our audience has seen shows like The Pit on HBO, and they're going to be thinking of, Allegheny Health Network or, Pittsburgh. And so one of the questions is when we think of that, when we think of emergency medicine, it's stressful, it's difficult. You are dealing with individuals in a lot of times who have very difficult situations, and it's not easy to do that job. What would draw you to then kind of take on this additional responsibility of then being a state rep? I mean, that's a huge responsibility, and from my perspective, very stressful. So what got you into that?
For me, one of the great joys of being an emergency physician is that you get to care for everyone, no questions asked. And by the way, I love the show The Pit, based on my old hospital where I worked, Allegheny General. The aesthetic of the show and the acuity of the patients is very similar to what I saw there. And my career actually spans kind of Noah Wiley's portrayal of physicians. He was in medical school as John Carter in ER when I was a medical student. I remember watching the show. Now he's playing, Dr. Robbie as a grizzled emergency physician in Pittsburgh, and that might be an apt description for me. But I really, I think this is an extension of my role as an emergency physician. You get to see the strengths and the challenges in your community as an ER doc. And during COVID, I was president of the State Emergency Physicians Organization, and clearly we as emergency physicians were on the front lines. And I saw the divisions that existed in my community when it came to science and healthcare that really have extended to this day. And the combination of understanding the challenges in my community and also knowing that we needed more people with scientific and healthcare backgrounds in politics, in policymaking, because of the challenges we're facing. That's what motivated me to run for office.
Wow. And that's an impressive motivation. I mean, I know we've all seen a tremendous, I'm sure you probably tenfold what I have seen, but during COVID, a lot of very difficult things. After COVID, as you've now become a state rep, I believe 2022 is when you, okay, were elected. Is that right?
Yep.
Okay, so we're now past COVID, or we're really getting to the spot where people aren't really thinking about COVID as much. The general public is kind of, we're not seeing masks and things. Vaccine rates have gone down, unfortunately, but I think that shows again people aren't paying as much attention to it. They're not thinking of it. What are the issues that you are now seeing very clearly in your population in the community in regards to healthcare that you really want to address?
So the two biggest issues are access and affordability. Coming out of the height of the COVID pandemic, we saw a lot of health professionals who left the bedside, and that has created huge access to care issues. We are seeing continued difficulties with affordability of healthcare. We're seeing challenges to the financial viability of hospitals and really a number of healthcare settings. And so the combination of how are we recruiting and keeping people with clinical skills at the bedside? How are we making sure that the healthcare system is transparent and affordable to patients and the public, and as well as to clinicians and to those who administer the healthcare system? And how do we make sure that all of this system eventually leads to better healthcare outcomes? Because let's be frank, as the United States, we are well behind other industrialized countries when it comes to healthcare outcomes. And so all of that together are the challenges that we're facing.
How do you identify these? Are these people who are, individuals in your community who are calling your office? Are you reading reports? How do you keep your, mind attuned to what's happening?
I think it's all of the above. I mean, certainly the most important thing is what I hear from my constituents. That by far is the most important thing. But being the only physician in the legislature, I really hear from health professionals and those with an interest in healthcare from across the state. And so that really plays into it. And then what's happening in Washington, D.C., and the threats to Medicaid and the threats to the Affordable Care Act, all of that as well plays directly into the what I hear from constituents and stakeholders from across the state that motivates me and the type of legislation and the type of policies for which I advocate.
When you talk about access, what are some of the reasons you think, I know we talk about the staffing. Is that a problem that's unique to Pennsylvania, or do you think that everyone across the country is dealing with this? And if it's, why do you think Pennsylvania? Because I'm just thinking about the amount of medical schools here, right? I think it's like one in five or 1 in 4, come through, Philly, and I'm sure if you include the whole state, it's probably even more. So we have a lot of facilities and medical training here, right? And you'd almost think that Pennsylvania would be a state with not a lot of access issues at all, right? Because of the hospitals that we have, but yet we are having that issue. Is there any reasons why Pennsylvania, has a challenging dynamic?
Well, it's not unique to Pennsylvania. We've seen so many people who have left the bedside as clinicians, and it's expensive and a long process to become a clinician, whether it's a physician or a nurse or a PA or a nurse practitioner, you name it. It's a very long process and it's a very expensive process. And you're right to say in Pennsylvania, we have a disproportionate number of educational institutions, but we don't necessarily create the best practice environment. We've
Mm.
allowed a lot of consolidation in healthcare. And so many health professionals feel that they are widgets. They're not respected as the professionals that they are. We see that there's been a lot of increases in expenses related to insurance and affordability. And frankly, we have a reimbursement system in healthcare that rewards volume as opposed to value, and it also uh, motivates healthcare institutions to try and staff at the most minimal level necessary to reach whatever clinical outcome or clinical goal that they are doing. So every system is perfectly designed to get the results that it wants. And the problem is that we are incentivizing results that are not of benefit to our fellow Pennsylvanians.
You just used one of my favorite quotes of all time there.
Yeah.
That's it's I use that so often because we get frustrated sometimes at ourselves when we say why isn't this system working? Why isn't this happening? We have to realize that the results we're getting, the system is perfectly built for it, and that's what we have here. I have a couple questions though on this. Um, the first one is when you talk about consolidation, the argument I hear a lot is that Kaiser, of course, has acquired Geisinger. And so a lot of systems are saying, well, if Kaiser's coming to PA, we need to prepare, we need to compete with some of these larger systems. So we have to consolidate, we have to buy up practices. What could be done? What would you like to see happen? Is there any way that we could encourage like healthy competition? I mean, in your mind, what does that look like?
I think there are two very important things we can do. The first is we're either the only state or one of only two states that does not have a state level antitrust statute. And so I think we have essentially abdicated our responsibility when it comes to regulating the market and competition. And I would like to see a strong antitrust statute enacted that empowers state government to scrutinize these efforts at consolidation and potentially even break up large monopolies or large duopolies that exist. In Western Pennsylvania, we essentially are a two-horse town between UPMC and Allegheny Health Network. Both health systems do important work. Both insurance companies do important work, but a monopoly and a duopoly are essentially the same thing. And we don't have competition the way that we need to have across the state. The second thing that we have to do is we have to move away from a reimbursement system that rewards and incentivizes healthcare to be delivered like a just-in-time warehouse, like what exists in FedEx or something like that. That's not the nature of healthcare. And so when we talk about issues like private equity, or we talk about metrics, or we talk about driving patients through without value-based patient care and looking at outcomes, a lot of that is because of the reimbursement system that we have. And I can speak to this, especially in emergency care, where we have to pay for readiness, even when the volume of patients aren't there, because the expectation is we will be there in your time of need. And that means changing the reimbursement system so that it is more based on a global basis of healthcare and outcomes as opposed to the fee for service system that we have. Those are the two things that I think we have to do.
I agree with that a lot. I'm a huge proponent of value-based care. Everyone knows, that I am. I'm trying to get a PhD in population health. So I'm on the train of value-based care. And I think that it doesn't even have to be the existing model that we think of, but switching to a value-based instead of this kind of unit, like you said, in a warehouse, right? Which is where we're at now. I agree, but I still have some concerns with the new administration. Even as I'm preparing to start my PhD, I worry, is this going to be all back to fee for service? Are we going to really push things out into the private sector with no restriction? There's some concerns there, right? That this value population health, public health approach that really kind of looks at the community holistically isn't going to really be there in the next 4 years. What is your outlook over the next 4 years for Pennsylvania and specifically your constituents?
The most immediate threat coming out of the new administration is the threat to Medicaid and the threat to the Affordable Care Act. I think the Affordable Care Act is the American vehicle for making sure that everyone that we possibly can is covered by health insurance. What the Affordable Care Act did not do was really take an effort to reduce prices. And I am not seeing any effort from the incoming administration, from the Trump administration, to look at how do we expand healthcare access. Instead, what I see is an effort to tear away healthcare access from hundreds of thousands, if not millions, of our fellow Pennsylvanians. And Medicaid is the key. The House Republicans have passed a budget that would gut Medicaid, and that would have a devastating effect for my constituents, particularly children and senior citizens and the disabled and the working poor, but really for all Pennsylvanians, because the costs from the increase in uncompensated care will be passed on to all of us.
Mhm.
And it will threaten the viability of hospitals. So when we're talking about access and affordability, what the Trump administration and congressional Republicans are doing now are a direct threat to that.
What do you think can be done to fix this so that in 2030 we're not, or in 2028 we're not in a really bad spot? Because I think we have elections coming up, right, in a year. What do you think, can is this a fixable situation?
Yeah. Oh, we have elections this year, which will send a message next year. So when we talk about official elections and local elections and school board elections, trust me when I say that as an elected official, I pay very close attention to what's going on in my local community. So the elections in 2025 are important. Then, of course, the elections in 2026 are incredibly important. But right now, my fellow Pennsylvanians and really my fellow Americans need to raise their voice to their federal elected officials and their state elected officials that we're not going to go backwards. Beyond that, I think, what the Biden administration did with negotiation on drug pricing was a good step. They recognized that healthcare is a different market. And we need to move in that direction related to how we, regulate the marketplace on, essential goods. I think we do need to look at the accountability for the insurance companies. I have legislation that would penalize insurance companies who are denying claims for medically necessary treatments. Um, and those denials are being overturned at a high rate. That to me suggests that that is a systematic and wrong-headed approach to their responsibilities to pay for medically necessary care, and there should be accountability on that. Medical debt relief is a hugely important issue that I've championed as well. And then we need to look at cost savings through market-based mechanisms. Should we be looking at reverse auctions related to pharmacy benefit managers that
Mhm.
other states have done and have saved billions of dollars related to healthcare expenses? I think these are all things that we should be looking at. But the first thing is to not go backwards when it comes to health insurance coverage, accessibility, and affordability.
One of the questions I want to ask, based on kind of what you've said, you've outlined some good steps going forward, and I think involvement is very important based on everything you've said. None of that can be done with just one individual alone, right? A lot of clinicians like yourself, they would probably want to get involved and still practice, right? Because you said that you still practice as an emergency physician. One of the concerns is how will that interact with their employer? And I kind of ask, I know it's a little bit of an odd question, but how do you deal with a situation where, let's talk about consolidation, for example. You might feel something different in consolidation than does an employer on the medical side. As a professional, how do you deal with that situation? Do you have any advice for other clinicians out there who want to get involved in this political work, maybe run for political office themselves? It's very important. It needs to be done, but hoping that we could maybe, remove some of the fears that they might have.
So when I first ran for office, I did meet with my ostensible employers who do have a very active advocacy program. And we were very clear with each other. I was not a candidate reflecting their views, and I did not have an expectation that they were going to be supportive of my efforts automatically or anything along those lines. And in my role as a legislator now, obviously, I take the positions that I think are in the best interests of my community in Pennsylvania, and some of those are going to align with where I am in my other profession or not. I think the first rule is that you don't do politics when you're caring for patients actively in the context of your clinical realm. But there's a long history of physicians and health professionals advocating for patients and the public health beyond their role as clinicians. And it is a balance. My wife's a physician too. We have 3 kids. There's a work-life balance issue, but it ultimately comes down to what are your priorities and how do you feel like you can best affect change? That may be running for office. It may be becoming very active with your professional organizations. It may be organizing like-minded physicians to take action in a particular way and to advocate in a particular way, or it may be at a very grassroots level in terms of organizing things that advance the health of your local community, all of which are important. But it does require a decision about what you're going to do outside of your time as a clinician. And then the last thing is, I now work part time as an emergency physician. I don't work full time as an emergency physician. We have a full time legislature in Pennsylvania. And so it was a personal decision with my wife, that we were going to be taking a financial haircut because the salary of a legislator is not the same as a salary of a full time physician. And so that's a decision that people have to weigh as well.
I didn't want to bring that up because I didn't want to say anything out of turn, but that's
Yeah.
another thing I was wondering is the financial pressure, it's there for everyone. I think we've even physicians, right? People always assume, oh, doctors are doing well, but as you mentioned, tuition costs are rising drastically. Reimbursement has not kept up with the tuition costs or the interest rates on the loans. It's a tough situation for a lot of physicians out there as well. So I was wondering, when you talk about impact, right? You took this pay cut, you added to this some of the stress of the work. Do you feel like you have made impact in your role? Do you even anything anecdotal that you can share on the impact of what you've done in the last 2 or 3 years?
I mean, I think I think I absolutely have made an impact, and it's apparent both in legislation. I've had legislation that has passed related to the actions of insurance companies when it comes to reimbursement. The governor of our state is a champion for medical debt relief out of the legislation that I've proposed. We've been able to stop things that I think are very dangerous for health when it comes to turning back abortion rights in our state. That my victory and my advocacy was directly related to that. And then there's lots of anecdotes because being the only physician, even though I'm a relatively junior member of the legislature on healthcare issues, I think it's pretty clear that my voice matters in terms of the advocacy for my community, for health professionals across the state, and for the health and well-being of our state. And so I take that responsibility seriously as well. That comes about from having that background in the legislature. And you know, obviously at the state legislative level, we're dealing with issues across the state. So as impactful as my work was, in caring for patients here and, the academic work I did and others, this is a larger stage where there's hopefully the opportunity to advance the health and well-being of our community.
I really appreciate you saying that. I wanted to give something to encourage those who are listening to really kind of take up the torch. One last question for you. When you got into being a state rep, you of course are experienced. You have many years of experience. Some of, as we're seeing, physicians even in residency now are really doing some great work when it comes to unionization and organizing. Any advice or tips for those who are early in their career who want to make a big impact on their community of where to get started?
Yeah. I think the most important way to get started is to find like-minded individuals. It's very hard in our system of government and policy and really in society as a single individual to make a profound difference. You need to build coalitions, you need to build alliances. So I think it's a matter of deciding what is your most important priority. You bring up unionization. That has really been championed by residents and fellows because they're of a different generation of physician than I am or older physicians. And they came together in order to then be able to advance that agenda. And I think that's really an important way to do so.
Thank you so much, Representative Venkat, for coming on. I really appreciate it. What a wonderful conversation we've had. I've learned a lot about you, and I feel a lot more passionate. I hope that the passion comes through the screen, and we have people this year and next who are ready to really let their voices be heard and take up the torch. It's so important, and I hope that we can speak again soon.
All right. Thank you.